morning, everyone. It is 8:30. I will go ahead and call the June 7th meeting of the Clay County Board of Commissioners to order. Our first item on the agenda this morning is looking for an approval of the agenda. Also looking to your notes, there is an agenda addition, a request to fill a vacancy for a full-time truck driver position at the landfill. I would entertain that change in agenda and add that to item 11.
Move to approve with addition.
We have a motion to approve the agenda with the addition from Commissioner Campbell, a second from Commissioner Gross. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Your request is granted. The second item on the agenda this morning is the employee recognitions. Okay, Lori Flores. Good morning, Lori. Today, this plaque is given to you in grateful recognition for the 15 years of service to Clay County and its citizens. Thank you so much for your work.
Thank you. Thank you. So this is Lori. She is our full-time adult mental health targeted case manager. She is always busy. Her caseload is always full. And that is just a testament to the individuals that Lori works with and the folks that make referrals to her. If I could clone Lori, I would. She is the employee that everybody wants. She comes to work, she does her job, she works hard, and she doesn't complain. And that is something that, as a coworker, I always appreciated of Lori, and as a supervisor, I appreciate it even more. So thank you, Lori.
Juan Martinez.
Looks like a rookie.
Good morning, Juan. Today, this plaque is given to you in grateful recognition for the 30 years of service to Clay County and its citizens. Thank you so much for your work.
Thank you.
Sandy?
Boy, there's a lot I could say about Juan. I've worked with him for all 30 years. He started in the income maintenance unit, and then we were lucky enough to pull him over to my unit, and he's kind of run the gamut of all of the different things a child support officer could do. He's currently working on modifications to try and keep orders at the amount that somebody can actually afford to pay versus too high or too low. It's kind of key to all of our, what's the word I want? Everything that we need to do to meet federal time frames and that type of thing. Juan is also one who really loves to be involved. He's been on work groups with DHS. He has been on the MFSRC board for many years. He ran through the whole president piece of that, so he was in charge of the organization for a few years. And he also is one of those that he comes to work, he's always happy, he gets the job done, so he's right on par with Lori there. We're just really fortunate to have him.
Our next item on the agenda this morning is citizens to be heard portion of the meeting. Are there any citizens in the audience wishing to address the board on anything not on the agenda? Anyone wishing to address the board? Stephen, has anyone corresponded with you in regards to this item?
I have not heard anything, Madam Chair.
Thank you. The next item this morning is the approval of the payment of bills and vouchers.
Move to approve. Second.
A motion to approve the payment of bills and vouchers from Commissioner Gross, a second from Commissioner Ebbinger. Any further discussion? All those in favor of this motion signify by saying aye.
Aye.
Opposed, same sign. The request is granted. The minutes from May 17th and May 24th were included in the packet this morning.
Move to approve.
A motion to approve the bill, or the minutes as presented for the 17th and 24th by Commissioner Gross. A second from Commissioner Campbell. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. The minutes are approved. The 8:35 item on the agenda this morning is a consideration for the selection of the regional detoxification facility building site, floor plan, and shifting project from a building committee to a finance committee. Steve is going to pitch the beginning of this, and then we do have some representatives to present.
Good morning, Madam Chair, members of the commission. As you are aware, earlier this year, this board approved Klein McCarthy to further develop a pre-design that they actually first looked at back in 2018 when Public Health and Detox Facility applied for a grant through Minnesota Department of Health. Unfortunately, at that time, we did not receive that grant, but again, had that plan move forward, and there's a great deal of work that went into that. As part of the discussion through this process, this board asked to look at that two-story option, but also looked at adding a one-story option and a one-story with the ability to go up. And over the last couple months, we've had about four meetings and lots of conversations in between with the building committee to develop the pre-design. And today, Scott Feddick and Ben and Lance from Construction Engineers are here to go through the findings of what we discussed. And again, as Commissioner, Madam Chair mentioned at the end, again, we're hoping to have some board action on and direction of how you'd like to move forward. With that, turn it over to Scott.
Good morning, Scott.
Good morning. I'm trying to figure out how to scale this so that you don't have to look at all the stuff on the side. Good morning. Steve gave you a pretty good update of all the progress that we've made. So what we want to do is run through the site and the floor plans to show you what we've done, and then the exterior images of it, and then finish with the cost estimate. The committee had given us a site to test out. So this is the solid waste, am I saying it right? Solid waste plant.
Resource recovery, yes.
Resource recovery, okay. So what we're looking at is the area just down to the south. The fencing comes around through here. So this is undeveloped right now. So we were taking the eastern portion of that area and showing that as the location, so that we kept the front of the building facing to the south to the main avenue, and then came in off of the side road for our access. So that's what we had for the site. Again, just testing it out, not saying that this was a selected site. It was just an option to test it out and see how it worked. This is the floor plan that we got to after the third meeting. This was a one-story option. We also have the two-story. What we're trying to do is get all of the nursing centralized and get all of the sleeping rooms and housing around the perimeter so they all have natural light. And then figuring we've got the intake area in the front by the lobby. We've also got family visitation, non-contact visitation. So we're meeting those needs for the public to come in and do that. We've also, at the housing area, we've got counseling rooms at that end of the building, and then you see a corner area of the of offices. When we went through this, we did the initial cost estimate. Construction engineers, I've got Ben and Lance with me today. They went through and put a price to it, and what that was revealing was that we needed to do some more work on this. So we went through it with the user group, and really started taking, for simplistic ways of describing it, slices out of the building where things had grown in size. So we were trying not to cut any spaces if we could do that, but also just reduce some size. So reduce a little bit of the circulation. We did take out taking out a couple offices where we could convert some file storage over to offices. So we were looking at ways of making it more efficient to get some square footage out. That resulted in this building floor plan right now, and this option for the one story is just under, I believe, 3,000 square feet that we were able to take out of the building. So again, we've circulated that to the user group, and I think they're good with it. There's certainly some massaging, movement maybe of some of the pieces, but I think overall, the size of the building is where it needs to be now, and it is actually smaller than what it was in the pre-design report when you first went for grant funding. The gray shaded area, what we wanted to do was figure where could you add on to this building and showing where that would be if a 16-bed mental health facility addition ever came with this. That's where we would propose that would be positioned. This is the two-story option. You'll see in the pricing that it is larger in size because of the extra circulation, the stairs, the elevators, and those elevator lobbies, toilets on each floor and things of that nature. Again, we've got that, so smaller footprint, but overall a larger size. This was the second rendition of the site. This is looking as you would just turn off the avenue and head into the facility. So this is from the southeast corner. So you start to see what we're looking at as multicolored brick, trying to tie this a little bit in theme to what the jail and joint law enforcement are. So some of the same materials, color schemes, and those things. So we've got multicolored brick. We've got some metal panel up here to try to keep some of the costs down. Again, looking for materials, knowing your budget and using the grant money. We're looking for those materials that we can get started with right away versus a precast. And we don't need all the parts of the building to be that durable, or not necessarily durable, but that secure and bare where we're coming back in. So we were looking for those types of materials, and then just a little bit more articulation, bump outs and things on the front, just to give it a little bit warmer feel, break up some of that massing, again, not knowing what's going to be in that development area in the future. This
Is that front, Scott, is that
Yes.
front, is that the Sally Port? Is that what that?
Yeah, we've got the front area here is, this is one of the features that's being considered, kind of a front porch awning type feel. And then this is the intake Sally Port area here. And then you see from this point back, you see the housing with all the windows there. And then if you go around the side, you get to the conference room on the right side and offices to the far right. This is from the southwest corner, so we're getting it from, coming to it from the, driving along the avenue from the west to the east, just putting a little bit more articulation, so you see that the rest of the housing goes back along that wall, so where that light colored brick and the windows are, that's all housing on the left and the right side of the drawing. This is really the north side of the building. We've got an exterior, in the value changes, we bumped the vestibule inside the building, but we do have a fenced, kind of enclosed outdoor area that patients can go out to. This is looking the admin area, so you're seeing that with these windows, some mechanical louvers back here, and then administrative offices across this side. And then we get back to the front lobby area is up here and around the corner. So this is just a straight-on view of what it looks like from the avenue to get an idea of the overall scale. We put some dimensions on there just to give the construction engineers data enough to be able to price and put more than just a square foot price to this. So this would be the south elevation. the west, you start to see it in a little different scale, the north and the east. So I think with that, we'll get into the, have construction engineers run through the two options, the one-story, two-story, and then there are options at the bottom if we wanted to structure the one-story to be able to go vertical in the future. So we asked them to put a price to that also, and then some of the other design characteristics as options.
Sure. Morning, Lance
Morning,
Munson,
Lance.
construction engineers. I'll go ahead and hit some of the highlights. There's a lot of numbers here and a lot of information. So I'll kind of hit the highlights and then we can go into whatever detail you want to. So I'll start in the kind of bronze line, says total project budget. The first set of columns is the first story option. So you can see that's at just under 14 million. Second story option is just under 16.8 million. The square footage, like was discussed, is the kind of the big difference there. Some expenses that you get, like added stairs and elevators needed for the circulation space. It's kind of the big difference between those two. Moving up, I just want to talk about contingencies. Right now, we're showing a 2% owner contingency, a 3% construction contingency, a 5% design contingency, and then 3.5% escalation, which if you add all those numbers up, there's a lot of contingency. But at the phase of design we're at, we feel it's appropriate. Obviously, with what's going on in the market today, it's better at this point to be a little bit too safe rather than, trying to cut that number down and make it look as small as possible. It's pretty typical contingency levels that we would have at this phase. Up above, in the dark blue section, you can see we've got the numbers broken down to kind of give you an idea of where the costs lie. Nothing too out of sorts here. It is a building that requires a little more mechanical, electrical than just a standard building, some security electronics. On the interiors, there's some heavier grade detention, maybe not quite detention grade, doors, glass, stuff like that. We do have a generator backup, which we got listed separately. And then carrying down in the light blue is just permits, bonds, insurance, which is all just kind of percentage items. A few things that are a little higher on this budget than ones we've tracked in the past. Some big kind of changes in the last couple years. One, we've seen a lot of price escalations really over the last 24 months. A lot that are kind of shell heavy here just in the last 6 months, like structural steel and EPDM roofing. We are on a new site now. It's not an addition, it's a new building, so there's some site costs that are a little bit higher, having a dedicated generator and not being able to share some facilities. Not huge items. I'd say beyond the escalation, the prevailing wage, the state prevailing wage, has recently changed, and it basically doubled the labor for most items. So there's probably close to $1 million just in that prevailing wage increase that was recently made. Understand there's grant funding and that's just part of what comes with that. But I think that's the main things I'd like to point out besides the options that Steve alluded to at the bottom. Structural work for future vertical expansion, you'll see on the one story, just over 800,000. Like to point out that the numbers down here also include all of those same escalations and contingencies, so it's likely that final numbers on those, would be a little bit lower because you're accounting all that risk just in those little items as well. And then the front entry and back patio upgrades are listed there below as well. If there's any specific questions, I'd be happy to answer them.
Also, in the numbers, it's important to recognize that there is a $100,000 earmark to reimburse the solid waste department for the land, if the board went through with this particular plan. Certainly, I think later on in this item, we'll be looking for official direction from this board as to where we'd like to pinpoint that. But I think it's important to note that that is a earmark in there. Board questions on this? Certainly, staff is here. Staff has been quite active in terms of molding this facility to be as efficient in addressing the specific needs that this facility would deal with. So if there's questions for staff on that, certainly they're available for it. But there has been a great deal amount of value engineering, if you will, in terms of this proposal, understanding the market is crazy, but also understanding that we do have a grant award to deal with and trying to build a facility that would best address the needs, while also understanding the financial constraints. Commissioner Campbell.
Thank you. I want to go to, maybe the best way is this one here. And that's, Scott, that's the one where you supposedly had knocked off the 3,000 square feet?
Yes.
Right, in that one? So I noticed on here that the entire perimeter seems to be where the beds are.
Yes.
And so is the center area the area that is basically all the office support and?
Yeah, what we've got, the sleeping rooms need to have natural light, so we put those all on the exterior. And what we're trying to do is similar to what we would do in any observation you do in a hospital, you do in a correctional facility. We've got the main nurses station here and here so that they can see into all of these housing units. So we're trying to keep those vision lines open. These are the two hardened units that Lance mentioned. So as they come through intake, they go into these hardened units. The others are a little softer features. But yes, we've got this whole end from this point over. This is sleeping rooms. Then we've got the nurses, the RN, meds distribution. And then in the back here, we've got counseling rooms. The laundry is right here. We've got some observation cell, holding area right here. And then once we come through for the intake, we come through the lobby. The intake area is here. So then they process and bring them down through here. We've got different staff break areas, support bathrooms. We've got all of the extra, if public is coming in, you're kind of coming halfway in. So you process through the lobby so you can come into this area and then the patient can be brought down to see them. So we do have family visitation. We've got non-contact visitation here, contact in these small rooms. We've got a conference room that can be adjusted with the furnishings to be able to be a larger family visitation if we need to. And then this is mechanical, electrical area right here. Try to get that as centralized, but to the back of the building. And then this area right here is where all the staff offices are. And then this is a storage room that as they go paperless, we can split that and make that 2 offices. That's what allowed us to take these other 2 out.
So can you back up? So you said where the staff offices are right there, and then just to the
Left?
just to the left of that, that is what? Is that the entrance and the waiting area, or what is?
The waiting area right now, we come in through the front.
Oh, yeah, okay.
For the public, comes in through the front here. We've got the lobby out here.
I'm talking about way up in the, would be the
Yeah,
north.
there's a staff
The north end,
entrance
then,
that can
that
come through
big
here.
white shaded area there.
Oh, this?
Yeah.
That's the
Oh,
mechanical.
this is mechanical, electrical is
Okay.
in this area right here.
And so how many square feet would that be, and including the office space? In other words, if you were to look at that as a square, how many, do you know what I'm talking about?
I do.
I think the mechanical is 1,200 square foot, correct? And then each office is 194, and then the other one is 69?
Yeah, I can't.
Yeah, the
Small
mechanical
for me
room
to-
is 1,200 square feet. Each of the offices is 120. It looks like it's about,
So Scott, I'm, like this square right
Oh,
here.
that whole
That whole
quadrant.
square,
Yep.
how many square feet would that be?
I think it's about somewhere between 3,000 and 4,000.
Okay. Okay.
And in terms of if this board decided to go with a two-story, that really does change, Troy, maybe this is an opportunity for you to come up here too, though. This does change the staffing needs. Certainly, we'd have to have a different, more staffing on to account for both stories. And in terms of transporting the clients that Troy's staff serves, there's been some inefficiencies identified if we were to go with a two-story, if you want to highlight that. I know you've given us PowerPoints on that in the past, but in terms of the design specifically.
Yeah, essentially, if we had two-story and if we had 16 beds on the lower level and another 16 beds as the original pre-design was that Scott did, what that does is we average, there are days we have 16 now. So my thoughts are is almost immediately as this building opens, we're going to have more than 16, which means we're going to have to double the staff and run 24 hours a day, 7 days a week, 365 days a year for both floors. With the one-story design, as we progress, we could add staff. I think we had it figured out that we would need probably another 10 full-time staff to cover what we need upstairs. And if you look at the very top of the one story, I don't know if you can go back to that, Scott, there's an 8-bed pod way up on the north end. So my thoughts are is when the clients come in, they'll go into those first 2 pods with the 8 on the bottom. Those will be more detention grade. And then we got a female pod, and we'll probably use the smaller male pods and that intake pod. And my thoughts would be is the last pod we would probably use would be those 8 beds, depending on how we got to spread people out, things like that. So I think with our current staffing, we'd be able to start and move, see where our population goes. I think the saying is if you build it, they will come. We'll have to see if, how fast and heavy that these clients come to us.
Okay. Board questions? Steve?
I think one of the other things that we talked about in the event of going up, as far as the HVAC and making sure that there'd be cost to make sure that as we build things up, that we would be able to make adjustments there, correct?
Yeah, if you were doing the one story, the extra cost was to structure it so that you could go vertical. What we'd have to do is be very careful, take a look at what that would look like for the second level and make sure we don't put mechanical units right where they're in the way. So we'd have to move those. So we'd want to look at, do we put those inside the building or put those on an area where it would be roof and remain roof and not be built up? Because the last thing we'd want to do would be to build up the structure around it, move the mechanical to the top of that expansion, and then go in and tear the roof off and remodel that area. But that's the complexity of what it would take to do that.
Commissioner Campbell?
Scott, how many offices could you put in a 3,000 square foot area?
If they're 120 with some grossing factor, if you divided 3,000 by 150, try to keep it simple, 20? Well, you need some circulation too, so probably 12 to 15.
I guess, and again, I understand what Troy is talking about in terms of all on one floor for the staffing. I think that makes sense, what you're talking about there. But I still like to look to the future. And I'm not suggesting that we'd have to have an entire second story for everything. But I think maybe to look at the ability to have a foundation that could support a certain area of that to go up to a second floor, for example, for offices. So that's why I'm referring to that back corner area when I was asking those questions. You know, if you look at the amount of just what you mentioned, Scott, whether you have potential for 15 or 20 additional office spaces, that could also change maybe on the new piece that, or the other piece that we've yet to talk about, that maybe that could house the office support up on top as opposed to having to do more on the ground. And I don't know what it would take to, you know, Scott, it's kind of like when you design of course, we did have a 2-story at the LEC. But if you recall, we made sure that above the garage could support.
Yes.
So that's what I'm talking about. I'm talking about at least looking at the option for that, maybe a piece to be able to go up, to have future office space. That, to me, that setting the foundation for that could be cheaper than having to build, you know, another.
In the proposal, there is the 800,000 that's in this proposal is for the ability to go 2 stories for the entire, correct?
The entire area. Yeah.
So in terms of what Commissioner Campbell is talking about, if we were to identify a portion that could help reduce costs to only, say, allow one quadrant,
Right.
the potential to build up could be a savings.
Yeah, we certainly could look at that. If we went horizontal, the idea would be where this recess is that we could expand this corridor, add some more offices here. If we did mental health, this was the office section for them. So we thought we had enough room here to be able to do that horizontal, but you certainly could build above this. We would just need to plan for somewhere in this area, a stair and elevator, so we'd have to be ADA accessible to get up there. So we'd have to put that in and take a look at the occupant load. If it's an area that's, you know, half of this, then we'd have to have a second stair for exiting.
Commissioner Ebinger?
Would there be a problem if we picked a quadrant to reinforce for going vertical? Would it be a problem building over the mechanical, or is that something that?
I think what I would probably recommend, just even the way Troy was describing the processing with the intake area here, I think it would be easier if we're starting to look at an elevator somewhere in this area that would go up, and maybe this would be the better quadrant to be at, because then the mechanical equipment could stay in the back area here, and then that's all screened from view. So I think the front would be the better quadrant if we were looking at doing that.
Go up?
To go up. I think that's certainly, again, if you're going to bring counselors and things up to that level, we wouldn't want to do it back here, because now we're bringing people from that lobby back through some staffing areas. So I think this would be the better quadrant. And then in this area, you could certainly put those offices for the staff.
I guess I would just like to know what the additional, you know, Commissioner Moser said 800,000 to prep it for the whole thing to go up. And I'm suggesting not the whole thing go up, because I'm hoping that we never have to get to 64 beds.
Yeah, it's in the
We're gonna
red.
have a heck of a time staffing 32.
So it's probably more than half, because of the stairs and elevators are a bulk of that. But is it
Right.
75%, 60%?
Yeah,
Cost?
it's in the realm of $35 a square foot as a very rough budget. The bigger question is, are you adding the stairs and elevator on to your ground floor square footage when you're adding the second floor, or are you adding square footage to your first floor that you know you're going to later strip out and put elevators and stairs in? So it's 35 plus room for stairs and elevators, I guess is how I would.
I'd
look
probably do it in the future, just
Right.
why spend it now and it's shelled boxes
Right.
that you're not using or using for storage? I think I'd
Right.
just design that, master plan that, so it could be designed.
That's all I'd be asking for.
Yeah,
You know.
so if it was 2/3 the cost, 60% of the cost, or 30? I mean, if the half of the building is structured that way, and we're at 21,000, let's say 22, so 11,000 times $35 a square foot? And then throw
Yep.
some soft costs on that, or also?
Yeah, right.
Which I think is appropriate to talk about. I think, though, that part of the issue is if you were constrained by land to do that, you need to think about what is the cost trade-off, and does it make, what's your cost per wear? Does it make more sense to just go out on a ground level when you have the site that could support something like that? I certainly think growth for the future makes sense, but if the bulk of your cost is in stairs and elevator, and we've identified that this is a clientele that we're having difficulty dealing with stairs and elevator at our current site, does it make more sense, later on to not have to deal with that? But, I think that's part of why I'm appreciating having this conversation now is certainly there are commissioners on this board that have dealt with these building projects in the past as well, and pitching it to the next committee will allow us to all make sure that we have that input, because maybe it does make more sense to be upward in the future. If we all had a crystal ball, we'd know, but. Commissioner Gross, you also served on this committee. Do you have any questions or comments?
Oh, I just feel that, we've got Troy telling us what they need, we've got Scott here coming up with the architect, what we're gonna do with it, and putting all this together. These are the people that we have to satisfy, and, yeah, we can come up with more ideas about what if, but we don't know what if's gonna happen in 5 or 10 years, so should we build for that now? And I think we should build for that now, but we really don't know what we're building for yet, and do we want to go that big? And it's just, I guess I'm satisfied how we're moving forward.
Well, this board hasn't taken official action. We've talked several times. There are county-owned property committees and building committees and finance committees. We identified this site because of the space. Certainly, there's property that the county owns on campus here. That plan, because of size, would require a two-story option. But I think the first next step is this board to take an official action on where we would propose this site would be. Steve, I know that's part of the motion to select a building site.
Yes, Madam Chair, and as you mentioned, this doesn't force the hand of the board at all. It just makes sure that we can lock in from a cost perspective of that site and ensure that that's the area and the costs that would go with that.
Board questions, comments? Commissioner Ebinger?
I would like to make a motion that we approve the one-story plan, possibly, well, that we approve at least this site.
Yeah, let's have the first motion be
Yeah.
a site.
We approve the site that's been proposed here out on 15th. I don't know if, specifically.
So that would be
how
the
we wanna
south-
word that.
Southwest quadrant of the resource recovery property,
Correct.
Southeast.
South,
southwest. Southeast is the pond.
No, the buildable area.
Kind of south center, yeah.
Yep, the southern part. Okay, a motion to approve that site by Commissioner Ebinger,
Second.
a second by Commissioner Gross. Discussion. All those in favor of the motion signify by saying aye.
aye.
Opposed, same sign. Carries. The next item for discussion, continued discussion, would be a motion to select a floor plan. And I think that, I think the motion should be either a one-story or a two-story. And then as we kick this to one-story or two-story based on the proposal, because the option to go up is included in both, or included in the one, and then as it goes to other committees, they can sculpt the potential to go upwards. Commissioner Campbell, does that relay the concerns and questions both you and Commissioner Ebinger brought up?
Yeah, I just think we really need to be looking at this as a long-term investment. And I have yet to see any area within our county government where our space needs have been less than originally thought. That's maybe my 20 years worth of experience on here brings, is that we never seem to have enough. And as our county grows, the ability to have options available to us. Going back to the correctional facility, when that was first done, one option that was thrown out right away was being able to go up on that facility. And we couldn't go up because there was no, there was no design in place when it was originally constructed to be able to do so. Had we done that, that building might look a little bit different. There'd still be a lot of new, but there could have been a portion of that could have probably remained. So, and I think moving forward with a single story with the ability to still look at portions of it being designed to go up, I think is very appropriate. So I would move that we select the floor plan presented with the floor plan that reduced the 3,000 square feet.
The
That
one-story option.
That floor plan with further discussion to be determined by finance to see if a second-story option in the design is appropriate.
Vertical expansion.
Vertical expansion, yes.
There's a motion from Commissioner Campbell to approve the one-story option with the caveat to determine the vertical expansion piece.
Second.
A second from Commissioner Ebinger. Any further discussion? Commissioner Ebinger?
Just to keep beating this dead horse, I think back to 3 buildings in my career in public service that I worked in that couldn't be expanded upwards, where we just cussed the architect that designed them in the 60s. And I think that if we can do it, even if it's a quadrant, if we can plan on it and it will be there, I think that they won't be cussing us in 30 years. So I appreciate the consideration we want to give this.
Any further discussion on the motion?
Are we going to consider that then in the costs already? I mean, what we have to come up with money for that?
Yes. That will be part of the consideration.
Yes, it is included in the proposal estimate today for the full bit. And I think that through further discussion, we can evaluate what exactly this is. As you recall, none of this set in stone sets this board in spending this total amount today. But what this option does is allows us to move forward to further the steps towards building a project. Commissioner Campbell.
Madam Chair, in addition to that, I basically saw this site plan for the first time, this detailed one. And that isn't to say that we still can't look at modifications to the current floor plan as we move to the next steps. So the motion was to adopt the first floor plan, but that still doesn't mean to say, what if we could find another 2,000 square feet to cut out of it? We don't know that until we move forward, but.
Further discussion on the motion? All those in favor of this motion signify by saying aye.
Aye.
Opposed, same sign. The request is granted. Now, the next motion to consider is moving this detox facility discussion from the building to finance committee. And I don't necessarily know if building committee is the correct terminology, but the detox committee that Commissioner Gross and I serve on has really been part of the discussion for several years and helped staff when you were preparing the grant proposal. And also has been meeting, as noted earlier, in the past few months to craft the proposal before us today. For the public's knowledge, this board is not allowed to have more than 2 commissioners discussing this project at a time unless it's in an open meeting, which is important, and it's law, and we will continue to abide by that. In terms of the next phase of planning, which certainly has to include the finance discussion, I think that's how we will pivot it. The challenges that I think I need this board to weigh in on is I want this building to address all of the needs that our staff identify, but also the needs that this board is hearing within the community. And I want each commissioner, all 5 of us, to have an ability to weigh in on how this looks, the future programming that we provide to the clients that we serve. And when it gets to a point where we feel like we need more input from the commissioners, I will have a committee of the whole to discuss that. I think that we have the ability to discuss this at this board, and that's important, but certain issues will require work groups, and we'll do that. It will be advertised, and we will do that. But certainly the next motion would be to push this to the finance committee. Excuse me.
Who is the finance committee? I mean, is there a finance committee?
So Commissioner Gross, the Finance Committee is Madam Chair and Commissioner Campbell.
Well, and Lori and.
Yes, yeah. From the commissioner standpoint, those, and Lori and myself, and also Darren participates in that.
And as this, for the public's knowledge, we received a hefty grant that will go towards a majority of this. Certainly, we've heard from staff on the challenges that the COVID pandemic has brought to folks and their sobriety or substance abuse. And I certainly feel that the CARES Act, not CARES Act, but the ARPA grant funding could be used to pay for some of this. And there has recently been an opioid settlement in which counties will be awarded dollars to help mitigate problems with that. And I think that part of those dollars can go towards that. But those are the discussions that the committee will have to propose a path forward in terms of financing a needed facility like this is. Board discussion?
Well, I'll make a motion to move it forward from Building Committee to Finance Committee.
Okay, there's a
Second.
motion from Commissioner Gross, a second from Commissioner Ebinger. Further discussion? And then out of the recommendation from that committee, we will have paths forward for this board to approve in terms of advertising or RFP processes. Because of the timeline on the grant and challenges in supply, that will be fast-tracked. So members of that committee be ready to meet quickly. Anything else? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried.
I have a question for.
Yes, Commissioner Campbell.
Lance, when you prepared your estimates here, did you use the more recent, for example, steel costs and all those things as opposed to prior to the pandemics and?
Yeah, so we did a detailed estimate on this, so, we don't know exactly what the steel structure looks like, but we reached out to our steel suppliers and said, here's what we normally see in tonnages, what are your thoughts on both tonnage per square foot and price per square foot and price per ton, to really try and look at it a few different ways to be as accurate as possible, this early in the in design. And so we really do that on all the major items: mechanical, electrical, structural, site costs. So we dug in and did a detailed estimate. So although we still have those contingencies there as kind of an insurance policy for the budget, we do feel comfortable that we're capturing what price looks like today. Escalation that we have in at 3.5% is for the, what does it look like 6 months from now?
Even above that?
Yeah.
Thank you.
Now, the next piece that isn't a formal motion, but I think should be noted, is in our application for the grant and in the advertisement for this, we refer to this facility as a regional detox facility. And Troy is every day getting requests from area counties and providers to have individuals in this facility throughout the region. And I think as part of the Finance Committee discussions moving forward, it's appropriate for us to talk about potential partners in this facility. I think that we cannot turn a blind eye to the detox needs in our region. We see it on the news. We see it as you drive down streets. There are individuals suffering. And I think it's important that that we talk to border counties and a state or providers that are seeing this need and talk about, as we did with our regional juvenile center, the potential to partner with folks for beds. And I'm hopeful that those discussions at the Finance Committee could identify that as an avenue. But certainly, I've heard Troy talk a lot about how this plan will allow us to take women that are expecting and pregnant and provide a safe space for them to deal with issues. And Clay County is not the only county in this area that has issues like that, but we will be the only county in this area that has a safe bed for that. And I think those are important points to note. Commissioner Emminger.
In the 12 years I was police chief in this area, we never had adequate detox resources to address both the need of this community in this county and those surrounding us. And it's been a very frustrating thing. This gives us some potential. And I think if partnerships are formed like they were with the juvenile facility, it'll give us the resources as well to build facilities that can address this regional need. I have remember experiences where the detox center was full, and the closest detox we had was Duluth. And they would tell us that. And the individual is going to be required to sober up in the backseat of a police car as you're moving them towards the nearest detox. We didn't get them there. We found alternatives, but this is a need that goes way beyond our community. And I don't see any state, the grant is great, and that may be the state's contribution towards this, but there are not going to be state or regional facilities that are put up unless counties step up and take the initiative, and we need to do that. Also keeping in mind that if we have enough partnerships, we may have to revisit the size of this facility. As if you build it, they will come. So this is going to be a moving target, I think, depending on what kind of response we get from our neighbors.
Okay, so, staff, do we have adequate motions for moving forward?
I believe we do at this time, Madam Chair.
Okay. Anything else? Thank you so much, Scott, for the work that you and your department has done to get us to this point. Thank you to construction engineers for getting us estimates to move forward, and certainly Troy and Kathy and staff. This plan would not be possible without the work that you do. Thank you. All right, we're good. Thank you.
Thank you, guys.
All right, we are way over, but those were important discussions. The next item is a request to fill a vacancy for a full-time LPN in our detox unit. Ms. McKay and Troy.
Correct. Madam Chair, Commissioners, we recently had a resignation from a full-time LPN, and we are asking that we can advertise and fill this position.
This is a budgeted item. Commissioner Campbell motions to approve the request.
Second.
A second by Commissioner Ebbinger. Further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried.
Thank you.
Thank you. Presentation this morning and proclamation for Elder Abuse Awareness Day. Our social service supervisor, Kirsten Wagonest. Good morning.
Excuse me just a minute.
Yes, Commissioner
Kathy,
Gross.
before you go, do you want to give a report on our SAC meeting, or no, public health meeting that we had the other day? You gonna stick around, or are you gonna, you have to go? Okay, you're gonna be back. Very good, thank you.
All right, good morning.
Good morning, Madam Chair, Commissioners. My name is Kirsten, and I am the Supervisor of Behavioral Health and Adult Protection at Clay County Social Services. And this morning, I have Corrine Graham with me. Corrine is one of our adult protection workers. Tracy Sunday, the other adult protection worker, is on vacation and is not able to join us. We just wanted to take a few minutes of your time and give you an update on what Adult Protective Services has done in the past year or so. And Corrine's going to present that information. And then when she is done, I will read the proclamation unless, Madam Chair, you want to do that.
Okay, you got it.
So last year, in 2021, Clay County received a total of 516 maltreatment reports. That is a 22% increase from 2020. Adult Protection also completed 120 investigations in 2021, which was a 26% increase in investigations from 2020. Adult Protection responded to 5 Emergency Protective Services reports in 2021. Emergency Protective Services means basically an individual needs immediate intervention to meet their safety, medical, or basic needs. Some of the services that Adult Protection provided in 2021, we provided referrals for services such as Meals on Wheels, MinnChoices assessments, companion services. We assisted vulnerable adults in Clay County applying for medical assistance and other benefits. We provided education about maltreatment, abuse, neglect, and exploitation to the community. We attended meetings in the community for hoarding, the multidisciplinary team, and the Elder Abuse Forensic Network of Cass and Clay counties. In the last 2 years, Adult Protection has assisted in having 3 or 4 cases of financial exploitation successfully prosecuted with the assistance of local law enforcement and the county attorney's office. Adult Protection presented a case study for the Elder Justice Network in 2021 for their Elder Abuse Summit. We also have consulted with the Elder Justice Network and with other counties on particular case studies or cases and issues. Adult Protection has assisted the citizens of Clay County in getting needed prescriptions, food baskets, shelter, and medical attention.
Any questions?
Yes, Commissioner Gross.
So, I mean, that was a very good list of all the things that you were doing, but now we're saying we got World Elder Abuse Awareness Day. Are we doing anything in addition to that, all that stuff? Or are we coming up with something new, or we just saying this is, Wellness Abuse Awareness Day is, are there plans to come up with new programs, or are we just gonna continue doing what we have been doing, which was quite a list, I mean, but,
It is quite a list, Commissioner Gross. We are always looking at the needs of our citizens and the individuals that we serve. We do meet every day, if not multiple times a day, to screen adult protection reports, and we have conversations about the needs of our citizens and what else we can try to provide with the 2 full-time staff that we have.
okay. I was just wondering, but just hanging this sign up's not gonna do much. You know, I mean, you're gonna have to continue these programs you're doing, but I was just wondering whether we are gonna be involved in starting anything new for elder abuse, so.
I think to continue to raise awareness is one of the most important things that we can do with this platform. Folks watching that may not be aware that we have departments or folks that help deal with those problems, broadcasting this, and I think we've said multiple times at this board is if you see something, say something, and it really is on our community to continue to identify if there are issues of concerns, and then our staff can investigate. It's troubling to me to hear that there's a 20 to 22% increases over 2020. I struggle a little bit because the pandemic disrupted the ability for mandated reporters to see sometimes. So I want to, sometimes you need to have an asterisk behind the COVID years to see where the lines are progressing. But the underlying statement is that it is on our community to continue to watch out for each other. And I think that with proclamations such as this, that's what we're doing, is continuing the awareness.
Commissioner Gross, I will have Kareen address on June 17th. She is going to be meeting with the chief of police in Holly and is going to be doing a presentation. I don't recall where.
At the senior center and one of the elder apartment buildings in Holly for education about scams, maltreatment, and how to make reports.
And in the proclamation, there is an event on June 28th.
Correct.
The Elder Abuse Forensic Network. Commissioner Campbell.
Yeah, thank you. It's a lot of work for 2 people to do when it comes to all of the different potentials. And as this proclamation says, elder abuse can be financial, emotional, physical, and sexual. It can be each and every one of those, or sometimes a combination of them, and sometimes they can be happening in a place where you'd least expect it. I speak from experience when my mother was in a facility, and it turns out that there was some abuse that was occurring by staff in a facility. And so it goes without saying that if you see it, report it. Even if you're not sure, at least the ability to hear that, because some of those people who might be suffering with dementia or other diseases themselves, maybe not even understanding it themselves and are not capable of making their own reports. So yeah, it's difficult. This proclamation, I think, is extremely important just from an awareness standpoint, that all of our communities need to know that, you know, elders they're very much targeted in a lot of cases, and especially on the financial component piece of it. But so
Commissioner Ebinger and then Commissioner Gross.
Just in the time I was in law enforcement, the awareness, I can remember as a rookie 45 years ago, the state I was in started an elder protection unit. And they came out and trained us, and everybody scratched their head and went, really? And then as years progressed, more and more awareness came with domestic abuse, which very often the relationships are part of the abuse of elders. And as we progress, you have people now that are aware of it and specialized in prosecuting attorneys' offices. This awareness is key to the people who are first responders and frontline workers. And the support that professionals like you give us in responding to the needs of these folks, and the continued awareness of it is important. I don't think there's a law enforcement officer in the country now that isn't aware that elderly people get scammed and they get abused. And when you show up and there's injuries, or you show up and there's financial questions, right now, the information that's been provided through professionals like you and through this initiative has increased the awareness so that we can go forward and prosecute these folks. When I started, there was a complete lack of awareness in it. So this is an important proclamation. And the public, of course, are the ones that need to call. So I think this has got a lot of value today.
Commissioner Gross, I'm sorry.
I didn't mean to infer that you guys aren't working on this, and I just wanted to know if we're coming up with some new programs to work on, and appreciate what you've been doing.
Would you like to read the proclamation?
I will. World Elder Abuse Awareness Day Proclamation of Clay County. Whereas Wednesday, June 15th, 2022 is World Elder Abuse Awareness Day. Whereas the National Council on Aging reports that 1 in 10 Americans age 60 plus have experienced some form of elder abuse. Whereas elder abuse can be financial, emotional, physical, and sexual. It also includes people who are neglected and those who neglect themselves. Whereas we are all responsible for building safer communities by watching for and reporting possible abuse or neglect to the Minnesota Adult Abuse Reporting Center, and that number is 1-844-880-1574. Whereas the Clay Cass Elder Abuse Forensic Network multidisciplinary team's vision is to create a community in which people in later life can live in safety with dignity and respect. Whereas the Clay Cass Elder Abuse Forensic Network multidisciplinary team will hold an event on Tuesday, June 28th, 2022, in observance of World Elder Abuse Awareness Day. Do you want to read the next part? Now therefore, in recognition of World Elder Abuse Awareness Day, we, the Commissioners of Clay County, proclaim the 15th day of June 2022 as Elder Abuse Awareness Day in Clay County, and encourage all Clay County citizens to recognize, report, and protect all vulnerable adults from abuse and neglect.
Madam Chair, I'd move the proclamation.
Motion by Commissioner Campbell to approve the proclamation,
Second.
and a second from Commissioner Gross. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Thank you for your work. A request to authorize an RFP for the corporate foster care development for children and adults. We have our Social Services Director, Rhonda Porter, and Supervisor Holly. Good morning.
Good morning. Good morning, Madam Chair, Commissioners. Just to follow up on that last presentation, this agenda item really does tie into the adult protection area, because not only are elderly considered vulnerable, but also folks with disabilities, whether that be physical disabilities, mental health, substance use. And what we're talking about with this agenda item is the development of additional resources in our county to help in the foster care situation when those vulnerable folks are not able to live independently in the community or in their own home. So that does speak to Commissioner Gross's question about what are some of the things that we're doing in addition to responding to those reports. So this is kind of a development that really is aimed at serving vulnerable adults as well as children in our community. I'm actually going to let Holly talk a little bit about this agenda item, as she's the expert in this area, so I'm going to just turn it over to her.
Good morning. So this morning, we're bringing a request to the board for approval to send a request for proposal to Minnesota 245D licensed providers in the state of Minnesota to develop community residential services homes in Clay County. And so community residential services homes are more commonly known as group homes or corporate foster homes with that rotational staff and run by an agency or a corporation. So we'd be looking to develop for adults and children. And just a little bit of history on this. Back in 2009, the Minnesota legislature did authorize a moratorium on the growth of new beds and established a statewide capacity threshold. So since that time, some of our local providers have made the decision to downsize or close, leaving those corporate beds or those bed capacities to be repurposed with another provider. And that's what we're bringing forth today. So if these beds aren't redeveloped or repurposed, they will go back to the state to be used within another county. And we are hoping that we can have some interested parties or some interested providers in the state of Minnesota to develop those sites here in Clay County. We do have currently 12 beds that could be used for a new home or a new foster home. And we'd hope that with the positive responses that we are hoping to get, that we can offer some new options or providers to people in Clay County.
Yeah, and just to add to that, as Holly indicated, we certainly don't want to lose those 12 beds to the development of other counties, because we have a need. I think you've been hearing quite frequently about our need for additional mental health foster homes for both adults and children. There's not a county cost to this RFP. It's really looking to our local providers or other providers in the state of Minnesota that are willing to develop and utilize our 12 beds that we have here in Clay County for a resource for our folks that need placement out of their home or are not able to live independently. So it's a good thing, and I think they have given us a time frame to kind of indicate how we're going to use these beds. Was it June or July?
We've asked for, some of the beds will need to be repurposed by the end of this year and some into next year. So we are asking that providers develop by the end of the year.
Board questions? Commissioner Campbell?
So this could be in multiple settings, am I correct in that? We're not saying that this RFP says you have to create one 12-bed place.
Correct. Each home would be up to 4 beds.
Okay, maximum of 4.
So this would be similar to, some of our current providers are CCRI, Divine House,
Access, REM.
So they're some of our current providers in our county. So they may have, as Holly said, up to 4 that might live in a home, or there's other sites that are less than that are in apartment settings. We were looking at maybe two developments, maybe one focusing on children, perhaps one on adults. The other piece that we would be highlighting in this RFP is that we'd be looking for a provider that is willing to serve a bit more of our individuals that have more challenging behaviors or more difficult needs. So we really would be vetting our responses to look for providers that have expertise in serving clients with significant needs.
Commissioner Gross?
You're saying there's no cost to the county, so where do we become involved in this? What are we supposed to approve today that you shouldn't already be doing then?
It really is approving us to send out this request for proposal, and part of this is just wanting to keep the board informed of what we're doing and what this is about. If you hear about it in the community or are asked what is this about, we're really looking for to keep you informed and your permission to move forward with our planning. You're correct, it is something we need to do. It's something that we work with our providers on already in terms of developments. This is just a little bit more of a formal process, so we wanted to make sure that you were comfortable with how we were proceeding.
Clarification on the back of the memo, for the RFP request, it has, it doesn't have a date in there. Will you fill that in?
Yes, I will. I plan to give a 30-day timeframe.
Thank you. Any further discussion?
And one last, so this doesn't become a zoning issue in communities, does it? I mean, is it just, this is just residential areas?
Correct. Yep.
I'll make a motion to move ahead with this project.
Okay.
We have a motion by Commissioner Gross to authorize the RFP process.
Second.
A second from Commissioner Ebbinger. Further discussion. All those in favor of the motion signify by saying aye.
Aye.
Any opposed? Carried.
Thank you.
Thank you.
Thank you.
Item 6 is a bid opening for turn lane reconstruction. We have the interim county engineer, Justin Sorum, and Chris Carlson from the city of Glendon. Good morning.
Good morning. So the first item is a bid opening for the turn lane reconstruction on Trunk Highway 10 and Park Avenue in Glendon. So we did not receive any bids for this project.
Okay.
I did talk to Nathan Gannon yesterday, just to ensure there wouldn't be a loss of state funding if we were to rebid the project with a completion date of next year. So next week, I would look to bring forward a future letting date this summer with a completion date of next year.
Okay. All right. Any further questions, comments? All right.
Thank you.
Thank you. Thanks for coming. Sorry about that. The item next is a request approval to bid on the Mastic Creek sealer through the MinnBid process. Justin?
Yeah, so the second item is permission to bid on a Mastic crack sealer from MinnBid. It is an online site that the Minnesota Department of Transportation has where they sell a bunch of used equipment. So a Mastic crack sealer is used to seal wider cracks, and it also waterproofs some potholes and fatigued areas in pavement. So in talking with our maintenance folks and the emphasis on pavement preservation throughout our 5-year plan, I think this purchase is a necessary one. It would provide a lot of benefit to the county, especially on a lot of the overlays that we're doing when you see the cracks come back in a couple years. If you can get ahead of them, it's a huge benefit. In talking to our maintenance folks this morning, we've kind of been watching a couple of them, and I know I did ask for an approved bid of $20,000. I would like to up that a little bit to $25,000. So we do have ISF funding from our DuraPatch machine. It has a balance of $66,470.94. I would propose to put a 6-year life if we were to win the bid on this Mastic machine, at which time I'd look to purchase a new one. We would not replace the DuraPatcher, and we would also look to sell that on MinnBid, so it'd just be an outright replacement of that item.
I certainly think that a purchase like this at the cost presented is, you know, if you look at pavement preservation alone, what projects are coming in at right now, certainly would reap the benefits of preventative care that this would provide.
And just as an FYI too, I did get current numbers at how much it does cost to rent a machine. So last year we rented one for 4 weeks. It was a little over $2,000 a week. This year that price has gone up to $3,375 per week to rent it. And a new machine is a little over $80,000.
Yeah, pay for itself. Questions?
Are we looking at all that, like, I know all the cities need something like that too, and Are we looking to renting this machine to cities that they can use too, or?
We certainly could. I know last year we had a request from another county. Traverse County asked if we had a Mastic machine because they wanted to rent it from us. Unfortunately, we didn't have the machine, so we couldn't rent it, but we certainly could look at renting it out.
Board discussion.
I would move approval of up to 25,000 for.
We have a motion to approve bidding up to 25,000 for the Mastic. Any further discussion? A second from Commissioner Ebinger. Further discussion. All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. We, thank you.
Thank you.
We are a little ahead, behind schedule still, but we will go ahead and take a 5-minute break now. Thank you. With item 9 on the agenda, back from break. Thank you for waiting. A request from our Facilities Director, Joe Olson.
Yep. Good morning, Madam Chair, board members. This first item is it's a ARPA-approved project. It's basically it's a big pump down in the basement. It's connected to our tower up on the top, our HVAC system. We recently replaced the tower within the last year with ARPA funds. This is just essentially the bottom portion, pumps that pump it out. So I've gotten 2 quotes here, and I'm asking to move forward with purchasing a new pump with the low quote, with the total project cost of $10,250. The ARPA original budget on this was $18,000, so we came in a little under on this one. So.
Thank you.
Move to approve.
A motion by Commissioner Gross to approve.
Second.
A second from Commissioner Ebinger. The remainder of that original balance would then just.
Just goes back into the ARPA pot at the end of the day, what we're
Thank you.
tracking. So.
Further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Request is granted. The amended lease.
Yeah, so if you recall, 2 weeks ago, we had family healthcare folks in to take a look at leasing and the old child support area. So if you remember, there was the map with the area A and B. Area A was their current space that they operate dental services out of now. Basically, what they're asking is just that currently we have 2 leases now. We have a lease for Area A, which is what they've always leased, and the new portion, Area B. All we're asking on this is that we amend the original lease to reduce 325 square feet, and that's that break room they talk about that's down the hall, not part of this, and they felt with the new space that they'd just like to not have that space anymore. So I'm requesting today to amend the original lease on that Area A to not include 325 square feet on that. So, and that'll go hand in hand with my next line item, so.
Thank you, Joe.
Move to approve.
The motion to approve the amended lease by Commissioner Gross.
Second.
Second from Commissioner Campbell. Further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. The next item, and then Kathy, if you want to brief Commissioner Gross's question after this motion. Thank you.
Okay, so we're actually talking about the same square footage. This is the 325 square feet that dental is not using anymore. And years ago, this area, if you look at it, used to be kind of part of the public health wing. It's just, it's on the other side of a door that separates them. So essentially, working with Kathy, I think we've given them 2 extra office spaces just recently, and that's really helped their space issue. This is just basically the break room across from there, and it makes sense because it just kind of finishes off their hallway there. It's a natural hallway going into WIC. So we ran this by the building committee, and we felt that this would be a good use of space for us, and doesn't really impact the budget too much. As far as that, there is a revenue side of $44,068 is what the Family Service Center budget would
4,400.
Yeah, good correction. What did I say, 45?
44,000.
Yeah. It's a little different, yeah. No, 4,400. 68. So, and the Family Service Center would get that revenue, but then it would come out of Kathy's revenue, which she has budgeted for. But other than that, anything to add on yours? I know we're definitely always tight in that down there with the public health and WIC kind of sharing operations, and this would be a good thing.
Well, it certainly seems like a good use of space and nice to take the opportunity that was presented with the prior item and use it for your department.
Yep.
Questions?
You mean you need more space?
And that's just part of our space we need.
I think that goes to my conversation earlier.
Yep, exactly.
I'll make a motion to approve.
A motion to approve the request.
Second.
A second. Motion was by Commissioner Gross. Second was from Commissioner Ebinger. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. I think
Board.
also going to the space question is, there should because of the board action today, we should probably start some significant discussion about the detox facility in the Family Service Center and what the future financial strings with changing that would be and who would occupy that space. But that's not on the agenda, but certainly should be discussed.
Madam Chair, it has been an item that Joe has brought forward to the building committee based
Right.
on this action.
Okay, Kathy, do you want to update? Thanks, Joe, for your work.
Yes, thank you, Madam Chair and Commissioners. We did have a Community Health Board meeting, and that includes representatives from Clay, Wilkin, Ottertail, and Becker. We have two commissioners. Commissioner Gross is our representative, and Commissioner Ebinger is our alternate on that committee. And we meet twice a year. So we just had our meeting last week, and there was a presentation in regards from the Minnesota Department of Health planner and talking about public health. Our legislative priorities included a lot of needs for public health, including emergency preparedness, infrastructure, responding to public health workforce needs, local public health infrastructure, and addressing community health needs. So pretty heavy on what the responsibilities are for public health. We do have a state and local partnership in Minnesota, so we work really hand in hand with local public health and the state health department. So they are looking at a structure to address more of our public health needs and responsibilities that are ongoing beyond responding to pandemic, but things besides that. And so they're really wanting to be forward-looking and looking to see what we need to do instead of what we'd really want to do. So they have a framework that they're developing, and it is also with the SHAC group, which is made of commissioners across the state of Minnesota. That's the State Community Health Advisory Council. So they are also working with the local and the state agencies, and it's developing this framework for governmental public health in Minnesota and what our requirements are, what our responsibilities are, how do we carry that out with the lack of workforce and with declining budgets. So she went through a whole PowerPoint on that information, and I can certainly provide that to the commissioners at another time. But just meeting the community health needs and the priorities for our partnership with between state and local. We also talked about, we did receive a couple of grants through the Community Health Board. So they're grants that are funding all 4 counties. One of those I previously talked about at a board meeting. It was an infrastructure grant where we were able to apply for funding for a data and epi person. So we talked about that, where we can move our epi person or data person into that grant. It's a 2-year grant with hope that there will be ongoing funding after that, but it's a 2-year cycle initially. So that person works across the 4 counties. So it's not just for Clay County. It was a little under $200,000 for that grant. We also have a workforce grant, and that is again a Community Health Board grant. It started the 2021, I'm sorry, and it goes through June of 2024, and it is $200,000
to assist the 4 counties in building up some ability to have more workforce. And it's not a lot of money, but it gives us a little bit of money. We also have a Community Health Board funding that we are applying for. We have funding, have had funding in the past for our evidence-based home visiting programs, and we will be getting an application out to increase funding for those evidence-based home visiting programs across the 4 counties as well. And that's a little under $1 million, but that's really so we can have an evidence-based program meeting with pregnant women, and the program goes through when the child is 4, I believe. So we'll be visiting with those families. So it's nurses only, and they can provide all of the information, education, and developmental programs to make successful, so keep the parents either in the workforce or going to college, furthering their education, and then also ensuring that the children are safe and growing up as they should be in those homes. So that was the majority of our discussion, unless Commissioner Gross or Commissioner Ebinger have some additional information to share.
Well, I'll probably cover, thank you for sharing that. It was a long meeting, a couple hours of meeting, and they discussed a lot of things, and that's why I asked Kathy to be here to sort of tell us about what it's all about.
Smart.
I knew I missed something, and
No problem.
there's not to get into my report or whatever, but I'll discuss that later as far as with Chip, Pat Hollister talking about what the statewide health improvement partnership's all about and what he's been doing. So I'll cover that later.
Thank you.
Thank you.
Thank you very much, Kathy.
Thank you.
Okay, item 10 then on the agenda today is a request for approval of change order number 5 for the Resource Recovery Facility Construction Project. Steve and Kirk.
Good morning again, Madam Chair, Commissioners. This morning for your consideration is change order number 5 for the Resource Recovery Facility. There's two different items here. There's CP003B, the IFC drawings that basically pertain to some drain tile. We've talked about having some different water issues as part of the bay, trailer transfer bay, and so they needed some additional perforated pipe to help with that, the drain tile in that area. And then there was also, with our pre-engineered metal building, there was some additional structured steel that was needed in a couple different areas, along with some sump pump covers. And so the total amount of CP 003B is $43,112. And we also have PR 002B, and that basically came out of our state inspection. There was additional changes that needed to be made, mostly in our bathrooms, that had some different issues and also some mechanical things. So with that, I would yield for any questions. I would note, Madam Chair, that this would have an impact on the guaranteed maximum price. I would be looking to increase to $10,447.49.
Board questions.
Move approval.
Motion by Commissioner Campbell to approve.
Second.
A second by Commissioner Ebinger. The approval of change order number 5, which also would then in turn increase the GMP. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried.
Thank you.
Thank you. The next item this morning would be a request for approval to purchase equipment for the new transfer station. Mr. Rosenberger.
Thank you very much, Madam Chair. This might be the final stop for me on my Fairview farewell tour.
We can make sure you come another time.
Well, it's been rumored I might come back one more time, so it'd be my pleasure to do that. What I come before you today with is equipment for the new transfer station. I apologize for it kind of a sloppy presentation to y'all. We met with Commissioner Mojo and Commissioner Campbell and Steve on Thursday, and we had to get it out fairly quickly, and I rushed around, and Colleen was a big help, so I appreciate your help, Colleen, to get it out, but it's kind of messy and kind of cumbersome, so I'll try and go through it as quickly as I can. Essentially, the first page that you have is the equipment list, and that's the equipment of all the equipment that's going in the transfer station. Some of the equipment we've already ordered, and it's being constructed even as we speak. Those include the transfer trailer, new transfer trailers, which are 2 of those. There's also a used transfer trailer that we currently have that we're rehabbing, and those are the first 2 items up on the top. We also are having the roll-offs. We have 10 of those that are being constructed even as we speak, and we've paid for those as well. And upon discussion with commissioners and Steve, we've decided that we're going to hold off on the shredder for now. It's a very pricey item. I do think it's a pretty important item to have. It really would help as far as the bulky items, tires, concrete, to help prolong the life of the landfill. But at this time, given the cost increase that's happening at the resource recovery, we decided to kind of take a second look at that.
Thank you.
So essentially what we're asking for today is approval for a transfer trailer, or I'm sorry, transfer tractor used, and that will replace a 2003 Freightliner that has 700,000 miles on it. And it's sitting in the shop right now waiting to be fixed, and it's just caused all kinds of problems, and it's very, very costly. So the folks out at the landfill have identified a truck that they can use, and it's a 2018 Kenworth with 300,000 miles on it, and they can get that for $165,000. They also are requesting to order a new transfer tractor. That would be a international. It's a 2024, and it'd be a cost of approximately $200,000. And if we purchase that today, they hope to have that delivered by the end of the year. It's, that's a whole nother discussion, supply chain issues and things like that. So that's just a hope and a wish, if that. We also hope to order purchase a skid steer with forks, and essentially it's to use to move around material out at the transfer station. That's at a cost of $58,000. And also a hook truck, and the hook truck would be used to move around the roll-off containers out there at the transfer station. So that comes to a cost of $530,576. We are not going to order right now the furniture. We have plenty of time to do that, so we're going to wait on that. The cost for that is estimated to be approximately $75,000 today. So with that, I'll yield for any questions you all may have, and if commissioners wish to add anything, please do.
Thank you. As noted, Commissioner Campbell and I did have a conversation last Thursday, right before the deadline for this board, felt that it identified the needs that we will have with the equipment, but certainly in terms of the shredder, that's something that Clay County could utilize because of the flow of opening the facility and space challenges, we and understanding the cost, which is certainly over doubled, felt as though we could hold off with that need at this time. Commissioner Gross.
I was just looking at that shredder. I mean, isn't that something that we're gonna need for that place, or isn't that a
Madam
important
Chair,
part of it?
Commissioner, I knew I was going to get a tough question from you. Every time I come here, I always get one that makes me sweat a little bit, so I'm glad that I got that. I do think we need to have a shredder at some point in time. I really do, but it's right now it's just not feasible, I don't think, to purchase it. And interestingly enough, just before I came in here, I got a call from the shredder salesman that wanted to know whether or not we need to place the order. But again, I don't think we can afford that right now, but I think on down the line, perhaps we can, and I think it's something we should do.
And it's a big ticket item, but also Commissioner Campbell and I talked a little bit about how often we would use the shredder. Do you deal with it once you have a little bit of a backlog or a pile of mattresses? And our thought was that for at least the first couple of years, dealing with it as like gravel companies deal with crushers, to have someone come in to perform that work, shred everything down. Do we need it at the transfer station or do we need it at the landfill? I think those are questions that we will continue to kind of justify once we experience what it's like to have both facilities up and running.
Oh, I was just wondering, wasn't this part of the original plan to have a shredder, or?
Commissioner Campbell.
Yes, Commissioner Gross, it was. It also wasn't in our plan to see this thing go from $12 million to $22 million. So in our discussion, so originally the equipment components that Kirk is talking about today and requesting today, we had in our financial plan for capital equipment about $850,000. And as you can see, just with his request today, without the shredder, we are at about that $850,000, just give or take a couple $1,000s here or there. So within our financial plan, we're already, without the shredder, we're already at what we anticipated as costs associated with the bond. Not to mention, we're still struggling with overages related to, weather conditions and that type of thing that, we're looking at about another $620,000 that were related to that we have to somehow come to an agreement on. So the idea of the shredder is still there. I think until we wrap up this other equipment and our final project cost, we will better be able to determine when that shredder can fit in.
Madam Chair.
And actually where it should go.
Right.
Because now there's conversation, is that actually better at the landfill than it's going to be at the transfer station? So there's a lot of, because there's a lot of things that end up going to our landfill that don't reach the transfer station that the shredder would still be beneficial to have.
Exactly.
So-
And Madam Chair and Commissioner Gross, one other thing here I should point out is that, as Commissioner Campbell pointed out, the original equipment list, we had the cost of the shredder of about $300,000, and that's gone up considerably since then. So again, that's a factor that we have to consider. Unfortunately, we all have to live within the budget, and it's a struggle sometimes, but I think this is a prudent thing to do.
So how much is that shredder going to cost us next year? I realize you probably don't have that answer.
Well, actually, Madam Chair, Commissioner Gross, the salesman, obviously, he said most of this equipment is constructed in Europe, and they get a lot of the steel from the steel plant in Ukraine, and that's in rubble, and so he's already said that the cost is already going to go up, so that is a consideration, but I don't think it's anything to, sway the verdict at this point in time.
Well, and I think it's partly like us evaluating, like we did the highway department item earlier. Should we lease it for a couple years and then buy out a lease? We just don't know how much we're going to use this yet. I agree. I think the cost is scary when you look at a $300,000 to $855,000 jump, but dealing with the substantial overruns that we've had at the facility, felt this was the most fiscally conservative option.
And responsible.
So before you, there is a request for purchase. I hope we explained, based on the equipment list presented, what we would be approving, seeing as we've already approved the 2 new transfer trailers and then the refurb on another.
Madam Chair, if I
Yes, Commissioner Campbell.
If I can just kind of recap a little bit, especially when it comes to the tractors. We currently have 3 used tractors, 2 of which are extremely old and outdated. And so the plan will be to, moving forward, to have 3. We'd be buying 1 new, 1 used, but, decent. And then we would be picking the 3rd. We would take the best of the 3 that we currently have.
Madam Chair,
the
Commissioner, that's
the
right.
plan would be that would be used for our daily hauling of leachate from the landfill to Fargo. And the other two would be the ones that would either be going to and from the landfill or to Perham.
Madam Chair, Commissioner, that's correct.
Well, I guess that's what we have our committees for, to go through this stuff before we bring it to the board, and I'd make a motion to go ahead with the plan.
We have a motion by Commissioner Gross to approve the equipment list as presented,
Second.
and a second from Commissioner Ebinger. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Thank you.
Okay, one last one, next item. I'd like to request replacing the truck driver
Yep.
out at the landfill. We had a person resign, and we need to get that replaced.
Motion to approve.
Motion to approve the request by Commissioner Gross, a second
Second.
by Commissioner Campbell. Discussion. All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign.
Very good. Thank you. Just one last thing here, and if this is my last appearance, I just want to thank the board for all they've done here. They've been very, very supportive, both the current folks and, the new folks and the past folks. I've said this often when I come before y'all. I don't think the folks of Clay County really realize how fortunate they are to have the quality of elected officials that they do. And it's really remarkable. I think y'all are very, very diligent. You're very, very involved, and sometimes too much so, but you're very involved. And, I appreciate all you do, and I hope the citizens of Clay County appreciate what you do as well. So with that, thank you very much.
Thank you, Kirk, and I said this at the SWAC, but certainly we are fortunate for the time that you've given Clay County and the leadership, and certainly the advocation at the state level, $7.5 million worth, so thank you very much. Anything else? Okay, just an item of note on the upcoming meetings, we did add, there is a senior elected officials training tomorrow that will occur at 1 o'clock at the Law Enforcement Center. We did add that to the open meeting advertisement, so the public is aware of that. Committee reports, we do have quite a couple weeks of committee reports to work through, so Commissioner Ebinger, would you like to start?
Thank you, Madam Chair. Going back on Wednesday, the 25th of May, attended the Diversion Authority Finance Committee meeting. We approved a contract for janitorial services for their new location, approved 3 MOUs to go forward to the Diversion Authority Board, and discussed procedures for disposal or sale of organic farmland. And there's a new baseline process on financing, which resulted in a dashboard for the use of the board, which was also discussed and sent forward to the Board of Authority. The following day, on the 26th, I attended the Diversion Board of Authority. The Executive Director discussed the PFI awards, the American P3 Deal of the Year, one of that was awarded to the diversion. It's one of several such awards that they've received this year. We also discussed the groundbreaking for the channel, which will be on August 9th at 2 p.m. The Army Corps report indicated the 4 projects that have received bids all came in under the engineer's estimate, which is kind of refreshing, given the cost of everything these days to have all 4 come in under the estimate. The motion on organic farmland sale was passed, and that completed that meeting. Tuesday, May the 31st, I attended virtually the Minnesota Partners for the Red River Regional Dispatch Center. We had a discussion in preparation for our later meeting with the full group. The Budget and Finance Committees, they're part of the current Board of Authority that'll be the Executive Authority after the new JPA signed. were merged. And we also discussed the Personnel Committee, and I'll finish up on that discussion when we get to the joint meeting we had later that week. We discussed review of cost share on the operations of the dispatch center to go from 10 years, which is how it's always been following the national census, to a 3-year. Again, that was something we followed up with full group later that week. And that meeting took place June 2nd. I attended virtually. Thursday, Eric Johnson, who was acting on behalf of as attorney counsel for the dispatch center, reviewed changes to the November 2021 draft joint powers agreement. I'll run through some of the high points on this. It was a pretty extensive meeting. I'll try and pare this down. The Board of Authority will be, with this JPA, will be the elected officials who serve on it and are appointed by the various jurisdictions. The current Board of Authority, which is chiefs and sheriffs, will be, after that point, referred to as the Executive Committee. The Budget Finance Committee, which will have finance officials from the partner agencies, along with, correct me if I get this wrong, Commissioner Campbell, along with the chiefs and sheriffs, will also, there'll be members on the Budget Finance Committee, and their report their review will be of a budget that's prepared by the administration and the executive committee, and then they will forward that to the Board of Authority. The Board of Authority chair will serve a 1-year term. The vice chair will be the chair-elect, and each of them has to be from a different state, so that each state's represented at that point by either the chair or the vice chair. There was a list of items that will require a vote from both a North Dakota and a Minnesota partner, and then there was a shorter list that would require a vote from a Minnesota, North Dakota, and one Cass County vote, since Cass County will be the fiduciary of the dispatch center. And again, we had a continued discussion on cost share every 3 years. And some of the factors would come into a partner leaving or being asked to leave, how that would be handled in the future to make sure everybody was pretty well committed to this. And on Friday, June 3rd, I attended virtually the Partnership for Health Community Health Board meeting that Commissioner Gross and Kathy McKay have already alluded to. I'm the new guy on the block, and it was a good meeting, was a very extensive meeting. I'm learning the groundwork on this, and I think it's been well reported by Kathy. I don't have anything to add to it, although I think Commissioner Gross, being the chair, probably picked up some of the nuances I didn't get driving my car across, or up 29 while I listened to the meeting. On June the 6th, yesterday, myself and a number of people, including County Administrator Larson, attended an EDC meeting with the Minnesota partners. We had a representative from DEED. We had the Shannon Full from the Chamber, representatives from the city of Moorhead and from downtown Moorhead and Moorhead Public Service. We discussed a lot about expectations we had of EDC. We discussed, basically it was an overview of what the Minnesota partners expected. There was some feedback from Deed. I think we're getting a rapport with them that we've lacked in the past, which is nice to see that develop. Again, Joe Rosso from the EDC presented what they view as their primary objectives in providing services to all of their partners. Shannon Full addressed the ability of the chamber to work with both North Dakota and Minnesota legislatures on things that are important to us. And they rounded it up with a discussion on fueling our future and Cass County's job development authority that they're putting together with taxing authority and what that might mean to the partnerships as a whole. And most of that is just left open for discussions. And that completes my reports.
Thank you, Commissioner Ebinger. Commissioner Campbell?
Thank you. On May 24th, we had a building committee meeting. Items, I'm not going to go into too in depth because we've already had those conversations, but we did talk about the Family Service Center bathroom remodel project. I think that's going to be mainly towards the women's bathrooms over there because the men's bathrooms are in good shape. So then we had a little discussion about the old tower that's out at the landfill. We're looking at, Joe's looking at maybe seeing if there's an interested party in that. It could be used for cell phones or whatever. We talked about the public health space, that 350 square feet that we acted on today. We did have the start of conversations that Joe brought forward about the second floor current detox space. What would be some options once that's moved out of there? We had a little bit of a discussion about the household hazardous waste building, and then we also continued to talk a little bit about any potential needs for the DMV, with that, when that current lease expires. So that's still, all those things are kind of on the front burner moving forward. On May 24th, I also then had the Diversion Authority executive meeting, several things. There was a new baseline report that was out there that basically brought all of the current prices, and I think Commissioner Ebinger touched a little bit on that. There's a new baseline that updated everything from 2018 numbers to current numbers, and with that, basically it's like it's $400 million more, but that included the $75 million settlement that had occurred, and also new land cost estimates and eminent domain issues. All those things have driven that price up. The good news is with that process in place, it still is affordable and it still falls within the scope of being able to pay for it with the sales tax. We're looking at needing an annual increase of about 2.9%, and I think I mentioned that this last year it was like 10% or something, so it's certainly within motion. Then on the 25th, I had a Prairie Lake Solid Waste meeting, and we did approve a recommendation from the Finance Committee regarding the change in the wage rates for the grid, and right after that meeting, that next Saturday, that facility had a fire. Fortunately, it was contained and it was back up and running within a few days. We did receive a big thank you from them because Clay County did accept about 700 tons of wet garbage that they had to remove from that facility that could not be burned. And so they were very thankful for us on that. Also then on the 26th, Thursday the 26th, we had a solid waste committee meeting. We received a report update from construction engineers. There was a request from Moorhead council person regarding potential pollinator habitat planted on in our resource recovery area that we need to look at how that would be funded and where it would be appropriate and where it wouldn't. We got an update on the current issues related to Comstock construction out at the landfill. Everett Nelson gave a report and some current concerns regarding the landfill fires that seem to happen out there. And it seemed to be related to our cleanup weeks. It seems to be the time when that happens.
And lithium batteries.
And lithium batteries, so there needs to be some education on what to do with lithium batteries. They should not go in the garbage. And then on the 26th, we had that same day, we also then had our Moorhead Clay County Joint Powers Authority that deals with the diversion issues. I think the one thing that I want to add to, and I know that the organic land issue went to the Finance Committee with the Diversion Authority and then on to final approval by the Diversion Authority that next day. But I do want to point out that the process there, we have some organic land that is owned by the Diversion Authority, and then we have some organic land still needed to be acquired by the Diversion Authority. And so our goal is that we have pretty much a one-for-one opportunity to trade some of that. Now, that doesn't say that would be the final cost, but I know at our MCC GAPA meeting, member Van Amberg had asked the question, well, what's the process for that? And I think our response, and I think it was approved by the Diversion Authority, that should come on a first-come, first-served basis by those who are looking for trade. So the first person who wants to come and get their one-for-one acres, they're going to probably have their choice of what we have available. So I think that's an important component for those who are interested in that land to act. Then we had the Diversion Authority meeting itself. We did, I think Dave covered that pretty well, and I'm not going to go into any more of that. On the 31st, we did have our Minnesota partners meet on the dispatch center, and we were basically reviewing the JPA, draft of the JPA, and what issues within that did we have concern about regarding ours. And I think again, Commissioner Ebinger did a good job in outlining those issues. Then on the also on the 31st, we had our construction project update or meeting with the transfer station. And again, I think that some of the same issues that we acted on today were dealt with. And then on June 2nd, we did have the overall meeting with the Red River Dispatch with all members. And again, Commissioner Ebinger did a good job in reporting on that. I would add that on the Minnesota side, we are interested in the potential for a backup site being chosen that could, we're thinking that it'd be appropriate to have that on the Minnesota side. So we asked for what criteria would a facility like that need to be and what need to have so that we can maybe look at options that might be available for a backup site for that. Then we did, on the 2nd, then we also met with Kirk on solid waste regarding the equipment that we've just acted on today. And then And then yesterday, we did meet with the construction engineers to have this dialogue about where we're at with those certain areas of, that were increased costs due to weather and those types of things that went on. I mean, we were talking about that for an hour, and unfortunately, Commissioner Mojo and Mr. Larson had to leave for other meetings, so, but really, what boils down to is a certain section of the contract and what might be qualifying items that were there, and as we left, we felt that there could be the potential for, I think, and Steve or Commissioner Mojo maybe, but I think we were talking about $616,000 that were due to weather-related or dewatering issues that were unexpected within the process that we could look at as something that would fall under the contract where they would not be responsible for. And so moving forward, you know, we didn't decide anything at that point in time in that meeting, but I think that's a good start. It's what we asked for. Obviously, there's a lot more overruns than the 616,000. That amount, and I stopped in and talked with Lori Johnson yesterday after that meeting, and we're confident that even with that, we're still within our financial plan in terms of dollars that we had both bonded for and anticipated having dollars available to cover. And we did then ask, in addition to that, we said, well, what other surprises can we look at, or what are we anticipating through the rest of the project? And they did come up with the potential of another $475,000 that would be items that were not planned for, but have come up there, and that included the $150,000 that we told them to go ahead on before on that geofoam, that increased cost for that. That's included in that. It's, you know, it hasn't been paid for yet. It hasn't been part of a change in the GMP. The good news on it is, you know, if we come to that agreement on that 616,000 and we replenish the contingency funds, both the contractor and owner's contingencies, that would cover all of these new things that they're anticipating coming forward to. So, but I don't think we're in any position to make a recommendation on that, but because we did have to, other meetings didn't allow us to formally bring to you all a recommendation. But that's kind of where we're at, and what we're referring to in that 616,000 is under section 8.3.1 on the owner and contractor agreement. So we tried to focus on that, keep it there, and I don't know, maybe when Steve and Commissioner Mojo give their report, they can add to that, but it seems to me we're on the right path to determining or getting that piece, that financial thing resolved. That concludes my report.
Thank you, Commissioner Campbell. Commissioner Gross.
Yeah, May 24th, Tuesday, we had the building committee, which Commissioner Campbell's already reported on, and we went over during the meeting today. On the 25th, we had the Detox, and there again, that was covered. I mean, we covered that during our regular meeting today, approving that contract. June, I had a short meeting with the Buffalo Watershed, approving the work plan. It was just a matter of the plan's been all set up already. It's just a matter of approving it and moving on from there. Other than that, June 3rd, I had the public for health that Kathy McKay gave a report on, but I did want to report on Pat Hollister. He also was part of the agenda, and he was telling us all about what he's been doing, promoting healthy eating, physical physical activity and tobacco-free. He talked about all the projects like bike trails that they've been working on. They have gardens at St. Francis and Breckenridge, healthy foods in the schools, community gardens being done in Fergus Falls. Then Chase and McCoy, he's also in the DGF school. I guess they felt their biggest accomplishment during the past years have been the banned sales of vapor, of flavored vapor products. So they felt that was their biggest accomplishment. That was pretty much the meetings I've been at. Thank you.
Thank you, Commissioner Gross. On May 25th, I attended the Detox Committee meeting with Commissioner Gross, in which we talked about the needs and proposal with Clyde McCarthy for the discussion that we had earlier. Thank you for supporting that. Certainly a vital need in our community, and hopefully we can find a financial plan that will allow for that. I attended the Prairie Lakes Committee meeting virtually. After that, I did not attend the first part of that because of the Detox Committee meeting going over, and Commissioner Campbell did report on that. I do want to say that I do appreciate Commissioner Campbell's leadership in terms of dealing with the fire that they had on the tipping floor last week. He certainly helped mitigate that issue, and happy that Clay County was able to provide a site to bring that wet garbage to our landfill. I know that was a team effort with Kirk Rosenberger, so I appreciate that. I attended the Diversion Authority Land Management Committee meeting that day as well. We had land reports from the agents and updates. The 26th, I attended the SWAC committee meeting in person. We had the update from the Resource Recovery Center. We had a long discussion about the planting at the green space at the Red Resource Recovery Facility. Presentation from the Clay Soil and Water Partners. Once that project is done, I'm hopeful that the plantings that we plant out there really will be pollinator friendly, but certainly fit within the needs of the neighbors and our site. And an update on the Comstock construction at the landfill, update from Everett Nelson in regards to the landfill fire, the concerns. Valid points brought up in terms of making sure the fire department, Holly Fire Department, has access to that site. I think we were able to identify a call sheet for who needs to be notified and when, making sure the access is granted. And then we pulled an item from the city of Felton. They had a recycling project that they wanted to discuss, but we did pull that as they weren't present. That afternoon, I attended the MCC JPA meeting, went through the property acquisition status reports, signed a farmland lease agreement, and then did approve an amendment to the Crown Appraisal tax task order, and then the Compass Land tax task order. On the 31st, attended the Buffalo Red Watershed Policy Committee meeting that Commissioner Gross updated. We did approve the 2023 work plan and the minutes from the prior meeting so that they may move forward to submit for funding. Hopeful that they're able to get some projects with that work plan submitted. I attended a transfer station construction committee meeting. As noted, I think this board has identified those issues and approved those issues in terms of change orders that have come before us. On June 1st, Commissioner Kaylee and I attended the MPCA Clay staff SWCD feedlot reporting year-end review meeting. Certainly have a good path forward to work into compliance. It's a resubmittal of the 7 evaluations for site plans that had been done the year prior in terms of working and additional training for the tempo data entry. Our staff was able to identify a list of, for submittal that had been semi-problematic, and certainly MPCA deals with that and the submittals every single day, and so with repetitiveness, it's maybe easier than folks that are only doing it 6 or 7 times a year. So feel confident that our staff, who always does such a great job, but will continue to submit that in a timely fashion. On the second, I attended the transfer station equipment committee or equipment conversation that Commissioner Campbell and Kirk Rosenberger had presented earlier. Thank you for your approval of that. Certainly, we would love to be able to afford the shredder, but unfortunately, right now, feel like the path forward is the most prudent. On Friday, the June 3rd, I attended the Community Action Lakes and Prairies Diversity and Equity Inclusion Plan with all staff. Certainly feel as though the work ahead is continuing to change, but feel that they have identified a great path forward to make sure that we're identifying all of the ways we can serve the diverse population that Clay County has. And they did ask for input on committees to do that work going forward. Yesterday, I attended the MetroCog Executive Committee meeting. We did talk about, as the planning area changes because of the population, making sure that we're making sure that our plan and bylaws reflects the needs of this growing community. Great discussion from all of the different municipalities present. We did ask for approval for a new planner, and so hopeful that the full board will approve that soon. Yesterday, I also attended the transfer station discussion with the project contingencies, and unfortunately, when you have 3 meetings that all seem to line up in a calendar, they never seem to line up in times. Did feel that we were identifying those major cost overruns that certainly were related to items that you could not plan, and the weather and those groundwater issues certainly are one of them. I think we'll continue to have dialogue going forward about how we mitigate the overruns, but feel like we have a great working relationship with construction engineers, and I think between staff and commissioners, we'll be able to work forward on a recommendation for this board to reallocate those contingencies as we continue to move forward. One item that we didn't talk about yesterday, but I think because of the action of this board to move forward with the site plan for the detox facility is somewhere we can add in that $100,000 for the land purchase. Not sure if that could go into one of those, but certainly would be helpful as we deal with the payments. And then yesterday I also had a landfill meeting with Burns and Mac and Comstock and staff, and I think for the first time since I've been on those, we do have some good news. They were able to identify where the blockage is for the gas line. Certainly we'll have to figure out who's going to pay to identify or mitigate that problem, but really felt for the first time in a long time we're moving forward to operating that piece. We will have an in-person meeting this next week to with full staff to identify that. But that concludes my reports, other than breakfast on the farm, and a big gratitude thanks to all those partners and the Holly Lions that made sure that went out. I think I heard they served almost 3,500 people, so it is Holly Week, Holly Rodeo Week. Head out to Holly, there's lots of great things going on. In terms of the upcoming meetings, we did note the training tomorrow at the Law Enforcement Center at 1 o'clock for the senior elected officials. On Tuesday, June 14th, our meeting will be in the evening. We have at 5:30 our County Board of Commissioners, followed at 6:30 by the Board of Appeal and Equalization. And then the following Friday is our AMC District 4 spring meetings. Yes, Commissioner Campbell.
Madam Chair, if I can just ask a question, and I know when we set out and this is regarding our upcoming meetings and schedules. Colleen, do you know right now, do we have any agenda items on Tuesday the 5th that are scheduled? 5th of July?
July 5th?
I guess, Madam Chair, what I'm wondering here, because of the, and I'm not suggesting we don't have a meeting, but because a lot of people, and the holiday falls on the 4th, it's a Monday, and we do have a lot of people who are out, if we could consider maybe changing that meeting as well to later in the day, for those who might want to be out of town and be at the lake or whatever for the evening of the 4th, and not have to rush back here by 8:30. I just throw that out there for,
Yep.
you know, whether we, you know, change that to 3 or 4 o'clock maybe as opposed to 8:30.
Would it be, just in terms of keeping things semi the same, would it be appropriate to do a 5:30 meeting? So that there's no confusion, 5:30 the June 14th, 5:30 that night?
Yeah, we certainly can do whatever the board's wishes are. Yep, that would make sense.
I guess, you know, and that's fine too, but I was thinking more from the standpoint, if we were to have it even at 4 o'clock, and then if there were staff-related issues that they wanted to bring, you know, they could probably do that maybe still within that first time frame, so that we're not asking them to come back later after the business hours are closed. That's my only reason.
Right, let's talk internally about that. We do have a little bit of time. I would appreciate that. I think it's helpful for our staff to do that. I think when you have a morning meeting, it's easier for people of the public to maybe miss an hour or two of work if they need to come in person. 4 o'clock is a hard time for some people, but let's talk internally, what time makes the most sense, as Commissioner Campbell had requested. And I don't know if this board's ever done a Wednesday morning at 8:30, if that makes more sense, but.
I don't know that we have, but I just think from the standpoint, if there's requests that start to come in from staff on the 5th, I would just as soon be able to tell them later in the day versus, you know, if that's what our intent is. We can certainly wait till next week to decide that, but then we would, if somebody requests it between now and then.
Yeah, that's true. I mean, we're a month out.
And Colleen doesn't know.
Madam Chair, Commissioner Campbell, we do have a management meeting scheduled for Wednesday morning this week, and so we could bring that up as a topic.
And then let's have that as an action item next week.
Sounds good.
Is that?
Thank you. Yeah.
Thank you. Okay, Steve.
Thank you, Madam Chair. On 24th, I participated in the building committee that's been covered in detail by Commissioner Kroos and Commissioner Campbell. Also, on the 25th, participated in the detox planning session. Again, that's been addressed. I do want to just note again that we did, as Madam Chair mentioned, we did spend about another 2 hours after that meeting value engineering I guess potential project you saw this morning, and actually had a number of ongoing discussions throughout the last 2 weeks to get to where we were this morning. On the 25th, I also met with area administrators in the Fargo-Moorhead area. Again, a lot of our focus right now has been on the Red River Regional Dispatch Center, JPA, and much of that focus was again at that meeting. On the 26th, participated in the SWAC meeting that's been covered in detail. Also, the MCC JPA meeting that's been covered in detail. The 27th, participated in the Red River Regional Design meeting. Those meetings generally are every Friday. They've kind of honed in on site location and are trying to get to a square footage assignment so they could bring a number forward. Again, as Commissioner Campbell noted and Commissioner Everger, we participated in the meeting last week where we feel like I think we're honed in pretty good on that JPA, but an important piece of that is also the financial contribution that would be asked of all partners. And we hope to have that in the very near future. Last 2 weeks ago during the board meeting, 2 board members were assigned to the Holly Joint Airport Zoning Board that's being brought together for some additional zoning looks out by the airport. We found out after that meeting that part of the resolution that it needs to be non-elected commissioners. and so we need to find 2 additional board members. I spoke with Lisa Jetvik on the 31st, and we identified Matt Jacobson as one of our members would be a great participant for that, but we're also looking for a second participant. And I've reached out to Lisa and also talked with Commissioner Gross, also and Madam Chair, if there's different people who you think would be good candidates, to let them know. And we have 60 days. Commissioner Mojo received a letter, I think, in May 17th. We have 60 days to provide provide the resolution that was asked of this board, but we hope to have that before then.
We should probably have an official motion to remove Commissioner Gross and I from that committee as.
Sure, we can do that.
On.
So move.
A motion by Commissioner Campbell.
Second.
Second by Commissioner Ebinger. All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried.
All right, on the 31st, I also participated in the owners meeting that Commissioner Campbell has addressed, and Commissioner Mojo. On 31st, we had some ongoing internal budget discussions with Lori Johnson and some of our department heads. On the 1st, I met with Azad Barwari, our diversity and ethnic community coordinator. I've been meeting with Azad generally on about a weekly basis, as that position has been around since March, and we've been trying to help provide a framework moving forward. I have asked Azad to here in the next couple of weeks to come before the board and provide kind of an update on what he's been spending his time on and where he sees some of the impacts and needs moving forward. Also, I'm hoping to work with Kathy to have Sarah Dixon Hackey, who is our variable hour public health employee working on diversity, also present that day. On the first, participated in the MPCA follow-up meeting with Soil and Water that Commissioner Mojo has addressed. On the first, also met with Troy on some detox facility planning. On the second, participated in the draft review that's been covered by Commissioner Campbell, Commissioner Ebinger. Sheriff Empting was also present at that meeting. Yesterday, participated in the Greater Fargo-Moorhead Economic Development meeting with the chamber that is Commissioner Ebinger. He did a great job advocating our position in Minnesota and the importance of highlighting the benefits of Clay County. On the 6th, we had a transfer station discussion. Again, that's funding discussion that's been addressed. Also, they participated in an opioid settlement webinar put on by AMC. We were notified yesterday that it's very likely the first payments are going to be potentially coming in mid-July. It sounds like we're going to be receiving, if you recall from the board's action, we agreed to participate in both a Johnson & Johnson settlement and also the distributors, the 3 distributors that provided the drug through Johnson & Johnson. It sounds like the first payment is we're going to get a majority of the money through Johnson & Johnson in the first 7 years, but we're going to get one payment, a significant payment in the first one big payment that's going to cover the first 4 years. And so I think from a county standpoint, I think that we're going to want to have some ongoing discussions, probably a committee assignment with in addition to Kathy McKay. The memorandum of agreement that this board signed earlier put the public health as the lead strategist. Not that public health doesn't have a lot going on right now anyway, but an additional responsibility. And I think that that's something that we'll want to start here in the very near future on looking on how to best spend those dollars. We were also notified that there had been two additional settlements, one Purdue, and the other one is escaping me right now. But those are both nationally. There are $3 billion and a $1.3 billion settlement. Those will be agreed upon based on that same 75-25% formula that was agreed upon by the state. And those dollars will again be on top of what we received for Johnson & Johnson. We Currently, the Purdue settlement is being appealed, and so we don't have a date on when those additional funds could be allotted, but something just for the board to be aware of. Let's see, just to kind of give the board a quick update, we have 2 open department head interviews set up here for our solid waste department. That is actually this afternoon. And also our highway engineer open position will be interviewed for on next Wednesday. And so, and then I did just hand out each of you guys just to kind of highlight the great work our STS crew continues to do. We are highlighted with DGF School District. They are our employees and our STS crew from the jail provided Glendon Felton some help in their school, and they were greatly appreciative of that. And then just one final note, during the board meeting, we received notification that the power went out at the government center, but we believe that it's back on now. And so in the event that we had citizens that were calling out or stopped in, we should be back open for service. So that concludes my report.
Commissioner Campbell.
I believe our special events group is having lunch at the Family Service Center today from 11:30 to 12:45. For those who aren't in committee meetings till then, hopefully you can get over there.
Great. Anything else? Colleen? Brian?
Maybe, Madam Chair, I'll just update you. I think right before Memorial Day, we talked about the fact that the use of force trainings that have been going on. I did finish the last training with West Fargo Police Department, and they were very well received and went very well. And then as of that Friday before Memorial Day weekend, we had a formal announcement. If you may or may not have seen it, but the police chiefs and sheriffs from Fargo, West Fargo, Sheriff Johnner, Cass County Sheriff, and then Clay County Sheriff Empting and Moorhead PD all took part in an announcement and reestablishing full mutual aid so that we have SWAT, we have drug task force, and everything going across borders. And so just appreciative of the board's support. I know that was expressed during the news conference, as well as the mayors, the local mayors that were supportive of getting that worked through. So again, appreciate the board's support of that and glad to see it mutual aid's reestablished.
Thank you for your work on that, Brian.
Yes, Brian, thank you very much. Any further business? If not, we are adjourned.